welcome to a very special episode of MedSynapse. Today marks the new beginning of an exciting new collaboration with National Cancer Society of Malaysia, a dedicated series where we explore key aspects of cancer care, prevention, and treatment in Malaysia. This series is designed to bring healthcare professionals insightful, data driven, and impactful discussions, shedding light on challenges, advancements, and the way forward in cancer care. So, every 2 weeks, we'll feature expert voices from Cancer Society of Malaysia, delving into different facets of cancer prevention, treatment, and policy interventions, all with the goal of making a real impact in patient outcomes. As we know that cancer remains one of the biggest health concerns worldwide, and Malaysia is no exception. With shifting trends in incidence, survival rates, and evolving healthcare policies, it is crucial to take a closer look at where Malaysia stands today and where we need to go from here today. And what better way to kick off this series with Dr. Shumita Gunasagaran. She is not only a medical graduate with a Masters of Public Health, but also a passionate advocate for health equity and patient support. As the manager at National Cancer Society of Malaysia, she plays a vital role in leading cancer care and support services across multiple regions, ensuring that patients and caregivers receive the perfect guidance and assistance they need. So, Dr. Shrimita, welcome to the show, and we are so thrilled to have you here to share your insights on cancer context in Malaysia.
Hi, Adli. Thank you for having me. I would like to say thank you for coming up on behalf of National Cancer Society in Malaysia. It's a pleasure to work with you guys and looking forward to it.
Likewise, Doctor. So now, Doctor, to begin with, cancer remains one of the leading causes of death worldwide. So when we talk about Malaysia's cancer incidence and mortality rates, how do they compare with global trends and other specific factors contributing to these numbers?
Okay. So, of course, like you said, Malaysia is no exception to the cancer endemic that's going on right now. So, like many other countries, we face a very, very large growing cancer burden. In Malaysia, it's the fourth leading cause of death and we have seen the numbers consistently rising, and that is something that is concerning to us. Just to quote some facts and figures, our Departments of Statistics, Malaysia has actually found that in 2022, the number of cancer-related deaths were about 12.6% of all deaths among Malaysians in Malaysia, which is a rise from 10.5% in 2021. And we are seeing these sobering statistics also amidst the global average of 111 people per 100,000 having an increased incidence of cancer, global statistics-wise. And in Malaysia, this statistic is somewhere around an average of 120 per 100,000 for the population. And this is something that we take very seriously in Malaysia, and the Ministry of Health, all organizations that are looking into this, they are trying their best. And we can talk a bit more about it later on, but just to give you a kind of overview, top view, what we are very worried about right now is that we are seeing that when you say mortality rates, we are seeing that 65% of cancers are diagnosed at a late stage, which is stage 3 or stage 4. And this directly impacts your treatment outcomes, your mortality rates. And unfortunately, these just mean that you have very high mortality rates in Malaysia.
Yeah. So, Doctor, given these statistics, do you think that public awareness in Malaysia actually matches the urgency of the issue?
Okay, so public awareness in Malaysia has always been a slight issue. When I say slight, I'm undermining the issue. It's actually a very big problem. Public awareness is something that we feel is multifaceted in Malaysia because we are a multicultural landscape as well. So it's very difficult for us to to kind of align our health communications to ensure that all sections or all sectors of the public understand and are on board with these, screening, whether it's screening, treatment, or diagnostic. It's quite difficult for us to do that. So public perception and public awareness is definitely an issue for us, and it's not where we want it to be. And we are working very hard to making it to where it wants to be. Yeah.
Yes. So, as you also mentioned, the importance of early detection. So, early detection and treatment success are key in improving survival rates. So, from your perspective, how does Malaysia compare with other countries when it comes to cancer screening, treatment success, and overall patient outcome?
Okay. So I would I would preface this by saying that although it looks like we are on a global scale quite not quite there yet, there are many efforts that are being taken within Malaysia to kind of expedite and make this a bit more holistic view kind of thing. So if you want to say early detection, so early detection in Malaysia, like I mentioned earlier, we have a big issue with early detection because 65% of our cases are diagnosed at a stage 3 or a stage 4. This is across the board for most cancers. And this is significant because we have, for late stage cancers, we have fewer treatment options, higher cost of disease burden, as well as lower survival rates. And so this is a area that we are trying to really look into with the ramping of screenings and trying to detect cancers earlier and earlier as much as we can. And why does this happen is a whole other set of issues. But if I can summarize it, it would be, of course, like you said, low awareness, issues with accessibility, and most importantly, cultural perception about cancer screenings that are happening in Malaysia right now. If you want to compare it to a global scale, you would say our neighboring country, Singapore, they have introduced actually quite a bit of screening programs for early detection. So they have their Screen for Life program, which is a national health screening program that offers subsidized health screening as long as you are, in the risk category. And places like South Korea, where mammograms are well established, their breast cancer survival rates are among highest in the world, recorded at about 90%. And in Malaysia, to compare, we have a breast cancer survival rates of about 50 to 60%. And yeah, so you can see the staggering difference there. And also, for another common cancer is cervical cancer. Survival rates in Malaysia is about 51%, while Singapore and South Korea are over 70% due to their vaccinations and screening programs. Yeah. So that's the early detection part. Treatment success-wise, again, we are having quite a bit of difficulties in Malaysia in terms of mainly we are having a difficulty for financials in Malaysia because most of the patients who get diagnosed are not able to afford the treatments unless it's conventional chemotherapy. Then yes, we do subsidize in our government facilities. But anything more than that, targeted hormonal therapies are all paid out of pocket, and that's a big issue with us that you can see not only in Malaysia but most Southeast Asian countries as well have the difficulty of not being able to pay for that additional support. Yeah. Yeah. So it's a sobering statistics, but yeah, it's there.
Yeah, I think the funding part and the when it comes to payment, it really is an issue globally, also, especially in South Asian countries, like mentioned by you. But I feel there's always room for improvement, and with right awareness, it's always better that we prevent it. Now, Dr. Cancer prevalence can vary by region. So, what are the most common types of cancer in Malaysia? And do you see significant regional differences in incidence or risk factors?
Okay. So the latest Malaysian National Cancer Registry report by the National Cancer Institute of Malaysia has quoted the 10 most common cancers, and I will read out common the top five basically, which are our main concerns in Malaysia. So of course, number one, always there, forever there, is breast cancer. It never goes away; it's always there. Secondly, we have colorectal cancer, and then we have lung cancer, lymphomas, and liver cancer. So uh, why is this something? The burden of cancers being looked at is like you said, is very specific to the regional landscape. So when you see a global context, you kind of see an overview. But when you look at the Malaysian context, it's actually there's a very clear regional difference, between the areas or the regions within Asia, and this can be seen when it comes to both the risk of cancers as well as access to treatment. So to explain this a bit further, what we see in Malaysia is that urban areas like Kuala Lumpur or Penang, which are major cities within Malaysia, we see higher rates of breast and colorectal cancers, and this is mainly due to lifestyle factors. So people in the cities, based on our surveys and our studies, they tend to have more sedentary lifestyles. They tend to be a bit more overworked and stressed out, and things like that. And also their diet habits are mostly containing processed foods, not very healthy eating in that sense. And another thing that's a big contribution is an aging population. So the aging population in the cities contribute largely to the regional differences that we can see in terms of cancer incidence. But despite this, when you compare them with the rural population of Malaysia, you will see a very, very different story, whereby people are getting diagnosed with cancers there. But when it comes to treatment access, it's a big issue because Malaysian healthcare system is actually, we have a very centralized healthcare system. So oncology centers are only in major cities. And if you are from, for example, if you're from rural Malaysia and you are in a state that does not have a centralized oncology hospital, then you're going to have issues in terms of access to treatment. Just coming out to get those treatments will be expensive and time consuming. And most of the time, the people living in the rural areas are also socioeconomically not very well off. So it adds on to the burden. And, you see that kind of trickling effect that causes people to just, from the start, just say, you know what, I don't want to get treated anyway. So that's something that we see a lot in Malaysia, especially when you talk about the regional differences between the urban, the rural, and it's a whole gamut of issues that are present there. Yep.
Yeah, I think that is very important to note also, and there's always a difference between when it comes to rural healthcare, also adapting to it, and limited resources is also a challenge there.
Mm-hmm. Yeah.
So now, a strong healthcare infrastructure is crucial in the fight against cancer. So how well does Malaysia's healthcare system support cancer prevention, screening, and treatment? And are there any policies or initiatives that have been particularly effective?
Okay, so Malaysia, like I mentioned earlier, we have kind of emphasized very strongly on the screening part of the cancer landscape. So we look at prevention and screening very much more than we look at treatment. So I would like to say that actually one of our major milestones within the Malaysian healthcare system is that the Ministry of Health recognized that there was an urgent need for a strategic plan when it comes to cancer. So we actually developed the National Strategic Plan for Cancer Control, and it is a 5-year plan from 2020 to 2025. And it lays out a very comprehensive framework that improves cancer prevention, early detection, treatment, as well as palliative care. So what we have done in terms of areas of focus is that we are focusing on expanding cancer screening and early detection. By training more healthcare professionals to do point of care screening, as well as training more, working together collaboratively with other CSOs as well as NGOs to really go out there and do those screenings that are needed. Um, Besides that, we also, saw another pillar is improving access to treatment, where there is a real urgency to reduce treatment delays. This is uh, planned out by increasing oncology capacity, as well as setting up more cancer centers and decentralizing the healthcare, the oncology healthcare space in Malaysia. Besides that, we also, of course, have a strengthening of cancer registries and data collection. So, as part of this, it was made mandatory for every single hospital in Malaysia to report back to our Ministry of Health and our National Cancer Institute in the event of cancer diagnosis. And so that's how we are, making it more robust, making our data more robust to support any initiatives that may come later on as well. Um, and lastly, we are enhancing palliative care services. So, where previously palliative care was seen very traditionally as a end of life care, nothing more. Only if you're in stage 4, you get palliative care. We are now establishing palliative care centers within hospitals or major hospitals in each state to make sure that comfort care and end of life care, and even supportive care is given at a professional level at every hospital. Yeah. So
Yeah.
we are actually going in the right direction, I would say. Malaysia is going in the right direction. It's just, as it is with every policy, it takes a very long time to implement and actually do the lay groundwork and create something that is strong.
Yeah. Those are actually some great initiatives by Malaysia, and it's so great to hear about these initiatives that are actually making a real difference in cancer treatment. Now, cancer care is a global effort, and collaboration plays a huge role in advancing treatment and research. So, how does the National Cancer Society of Malaysia collaborate with international organizations to improve patient care and outcomes?
Okay. So National Cancer Society Malaysia, or NCSM as we call us for short, we have actually been at the forefront of cancer care in Malaysia for decades. So we are actually the first non-governmental organization for cancer care in Malaysia. So we have been here for a long time, and we are able to. One important thing that we see in NCSM is that we always try and understand the landscape around us. What is being done, what is not being done, what can we work with, what can we complement, what can we innovate and try and do something new there. So our work generally revolves around 3 pillars, which is educate, care, and support. And it's mostly to take a very holistic approach, where we do awareness, early detection, and patient support. So that's what educate is for: awareness, where we do a lot of public education campaigns. We do a lot of policy advocacy and working with government organizations. And then care is more for screening programs, outreach, diagnostic services, and support is for those who have already been diagnosed with cancers, whether patient or caregiver. We help and support them through mental health services, dietetic services, as well as peer support services. So when you ask the international organization collaboration question, I will say that Malaysia or NCSM is very good at what we do, what we call is a multi-stakeholder approach. We are when we mount any project, we always look at how is it going to be a collaboration between from grassroots community level all the way up to ministry level, as well as international organization levels. So just to lay a bit of examples of the work that we have done. We have I'm going to take a project from each of the pillars that I spoke about. So for the educate pillar, we had a beauty project. What does this mean? It's basically it's a initiative where we created educational videos and materials on all major cancers in Malaysia, and these are available in all 4 languages, four major languages in Malaysia. And the really interesting part about this initiative is that we actually work with barbers and saloons. So
Oh,
what we did was, we went to barbers and we went to the salons and we said, hey, we understand that the community trusts you. So, for example, you and me, when we go to a barber, we find that they're doing a good job, or we go to a salon, we find that they're doing a good job. We tend to stick to that one person, because we know that we'll get our money's worth and we'll get our. And so when you stick to that one salon or barber for a long time, you create a kind of relationship with them that is, a very mutually respectful relationship. So we are trying to leverage on that and um, and spread the awareness. So we educate the barbers and the people at the salon and say that, hey, look, this is what the cancer is. These are the materials that we have. Would you mind if we put it in your shops? Would you mind if you talk to your patients a bit more about screening? Would you mind if we play these videos on loop in your shops? We will provide all the things, the TVs and all those things, but we just want a space for people who are coming, sitting down and looking at it and to say, oh yeah, I should get screened for cancer. Oh, this is what this cancer is. So that was one project that we are very proud of. That is actually that's actually in collaboration with international organizations as well. And then the next one for care was leaving no one behind. So this is a major project that we just wrapped up in 2024. And this was in partnership with the Malaysian government as well as the Ministry of Health. And what it did was it focused on HPV vaccinations for underserved populations, particularly indigenous communities and those from the lower socioeconomic backgrounds. And particularly those who missed their school-based vaccinations, either due to COVID or if they were not going to school at all, as is seen a lot in underserved populations. So this program actually enabled us to vaccinate close to 280,000 people in a year. And, as you know, cervical cancer is the only preventable cancer. And, the vaccinations are the only way to prevent those cancers. So we actually saw this as a huge step forward in preventing cervical cancer in Malaysia. And the next thing I will talk about is the patient navigation program that is being done by support team. And what we understood, where we saw the gap in this was that patients who get diagnosed with cancer, they feel very lost most times. Right after you get a diagnosis of cancer, you feel like your earth is shattering, you don't know what to do, you're not able to understand or comprehend what's going on around you. But for everybody else in the cancer ecosystem, life goes on. For them, it's okay, you got to go do this scan, that scan, take your blood, do this, do that, next steps. So what we aim to see is that why don't we help the patient and the healthcare professional out by putting someone who is a community-based navigator who is actually trained. So they are trained with NCSM, and we provide them the basic context of what cancer is, what you can do for the patients, what are the barriers that the patients are facing. And they then speak to the patient right after diagnosis and help them out in terms of, what are the issues that you are facing? How can I help you? Am I able to, signpost you to the relevant services? And this then allows the patient to reduce their dropout rates because we try and solve the barriers for them to reduce their dropout rates. So these are the kind of programs and projects that we in NCSN embark on to, ensure that we live by our commitment to make cancer care more accessible and effective as well. So with the right partnerships, on the ground efforts, multi-stakeholder engagement is something that we do every day. And we try our best to improve the cancer care landscape in Malaysia, alongside many other NGOs who are working very hard as well.
Yeah, that's fantastic. I think these partnership actually offers and practice significantly improves patient care also. It's really interesting to know these initiatives by you. So finally, looking ahead, what are the key priorities for improving cancer prevention and treatment in Malaysia? And more importantly, what role can healthcare professionals play in driving these efforts forward?
Okay, if I were to categorize the key priorities, I would put it into three categories. The first big priority that we have in Malaysia is, of course, the early detection. As we've been speaking about, too many cases in Malaysia are diagnosed at late stages. This is not something that we should look upon with a relaxed lens. It's something that we really need to take up and you know try our best to improve as much as we can. And while there is a national screening program and while there is a national cancer plan, the uptake for this is still much lower than we'd like. And um, where we see the healthcare professionals or the NGOs playing a crucial role is really just to bring awareness campaigns out there and also ensure that screening is much more accessible and also ensuring that the continuity of care is there for those patients who are screened positive. And these efforts really have to complement and fill the gaps where public healthcare may not fully have a reach to. Um, and that's the first priority that I see. Second priority is, of course, improving access to cancer treatment as well. So you have the screenings, you've already gotten the people who have been diagnosed positive, and when they want to access the cancer treatment, we should make it as frictionless as possible for them in Malaysia. And this is something that we are. Or I would suggest that we go ahead with by expanding the regional cancer treatment centers. Decentralizing, like I mentioned earlier. Embarking on telemedicine services and using community-based patient navigation or community-based buddy systems to close the gap. And it's while we understand that the healthcare system is a very complex healthcare system in Malaysia or anywhere as well, there are many things that you can do on the ground that will bridge those gaps and make sure that the patient does not fall out or drop out of treatment, and the patient has increased access to treatment as well within Malaysia. And the third priority is very simply just financial accessibility. Things like targeted therapy and immunotherapy are up and coming, and they have shown wonderful results in terms of survival rates and reduction in mortality rates. The other thing that we're looking at is also that increased insurance coverage for treatments of cancer, because we all know that the coverage is very low right now, and while there are again many other NGOs that offer financial aids and financial protection and things like that, or funding, but it's still not enough to cover the cost of treatment for many patients. And we need to advocate for policy change for this to happen, and for prices as well as insurance to be looked upon at a very serious lens at a national level as well as an international level.
Yeah, actually, that seems to be a strong call to action, like awareness, early detection, and access to care, both in terms of financially and the accessibility. It actually seems to be pillars for a better future in cancer care. So, thank you for sharing that. So, Doctor, before we wrap up, do you have any final message for our audiences, whether they are healthcare professionals or individuals looking to make a difference in cancer prevention?
I think my last call to action or my last remarks would just very simply be the recognition that improving cancer care in Malaysia is not just about one big reform or one big concerted effort. It's about incremental, meaningful changes across the continuum, where it's prevention, treatment, as well as support services. And if we can get more healthcare professionals and other CSOs and NGOs on board, involved in all of these areas to try their best to bridge the gap, and it will be a huge step forward, and it will be us making sure that no one is left behind in the fight against cancer.
Yeah, that's a beautiful message, and thank you for sharing that. And let me tell you that this has been an incredibly insightful discussion, and I truly appreciate your time. So, thank you so much for shedding light on Malaysia's cancer landscape and sharing your valuable expertise with us. Thank you.
It's been my pleasure. Thank you so much. Thank you, MedSynapse, as well.
Thank you. And to all our viewers, this is just the beginning of our exclusive collaboration with National Cancer Society of Malaysia series, which is NCSM, as Dr. Shumita mentioned. And every 2 weeks, we'll be bringing you expert-led discussions on critical aspects of cancer care in Malaysia. So stay tuned, engage with us in the comments, and let's work together to make a difference in the fight against cancer. Thank you so much.